Turning now to a health alert across the country. It's estimated that millions are dealing with post-COVID-19 complications, which are known as long COVID.
Yeah, we've heard a lot about that, and now the U.S. government is launching a more than $1 billion study on that condition. Our Demetrius Sanders now joins us live in studio.
And he shows us how the study will make an impact right here at home. Demetrius.
Well, Rebecca, Shelby, the CDC says surveys show nearly 1 in 5 people who have contracted COVID-19 are still having symptoms of long COVID. Now a study, which is expected to involve hundreds of Central Illinoisans, will help researchers have a better understanding of the condition. More than 2 years since the start of the COVID-19 pandemic, doctors and scientists say there's still many unknowns surrounding the virus, one of those being a condition known as long COVID.
So millions of patients have described these prolonged effects of COVID. Symptoms that hang on past a month, sometimes out to a year.
Surveys with patients have shown long COVID has been characterized by more than 200 symptoms.
Things like brain fog, a long-term shortness of breath, inability to sleep, depression.
With nearly $22 million from the National Institutes of Health, researchers with the University of Illinois College of Medicine Peoria and the University of Illinois Chicago are creating a study coalition known as AllyNet Recover to learn more about the condition.
This study aims to study the causes, prevention, and treatment strategies for long COVID.
With the help of community-based organizations, AllyNet Recover hopes to recruit 1,000 Illinoisans age 18 and over that have recently tested positive for COVID. The 4-year study will involve several visits with local health providers as well as surveys regarding health history.
They also ask some more questions about kind of demographics, so where you live and other things that can potentially affect your health that you might not necessarily think about.
And medical leaders say the study is not just beneficial for researchers, but also the community.
We have the opportunity for these follow-on clinical trials for our folks to be able to get the first access to those treatments that might be out there.
Now, to enroll in the study, you're encouraged to call the number on your screen or visit allynet.org. Shelby.